Pregnancy is not a disease. Um, there are physiological changes in the body, and pregnant women have an increased risk for the formation of clots just because of the pregnancy. And we know now that COVID-19 is a systemic disease. It affects many of the organs, and all organs where we find the receptors for the virus, which is the ACE2 receptors. And the heart is one of them that have ACE2 receptors. So being pregnant means an increased risk for the formation of clots, and COVID-19 generate a severe inflammatory response that at the end can also produce more clots. So that is why the risk for women that present with moderate to severe COVID-19 have greater risk of complicating it.
What about the risk for postpartum women?
Well, I read there in the literature that there have been cases diagnosed in the postpartum period and complications that arise in the postpartum periods. So it's just remember the pregnancy. The woman does not return to her normal non-pregnancy state until after more than 7 weeks then. So that first 6 weeks, which is postpartum period, the risk is there for complications if they do get moderate to severe illness.
So what should pregnant women be doing right now to protect themselves and their babies?
For pregnant women, we want to remind them that they must practice all the transmission precaution measures that is valid for other persons, no? Or other women that are not pregnant. But especially them while they are pregnant, because they should try to avoid as much as possible getting infected with COVID-19. So wearing the face mask, covering the nose to the chin, washing their hands as much as often, cleaning down surfaces that are touched frequently, keeping 6 feet distance, avoid crowded places, and the next thing is stay at home. What we mean by staying at home, as I mentioned earlier, if they're working, well, they have to go to the workplace. But if they're at home and they need something from the store, then don't go to the store. Stay home and get someone else from the family to go to the store and get the items that they are needing. But they have to protect themselves as much as possible. Stay at home and stay away from sick people. Irrespective of what the sick person have, nowadays, any illness is COVID until proven otherwise. No?